Let's talk about American healthcare, a system so complex and expensive, it can leave even the most organized person feeling overwhelmed and powerless. From the outside, our hospitals look like gleaming temples of modern medicine, promising hope and healing to all who enter. But step inside, and you quickly realize that the path to care is anything but straightforward. In fact, trying to understand your medical bills or insurance paperwork makes assembling IKEA furniture look like child's play. At least with IKEA, you end up with a chair. Here you're left with a headache and a stack of confusing forms. We're constantly told that American healthcare is the best in the world, a shining example of innovation and expertise. But for most people, it's like being invited to a luxury cruise, only to find yourself handed a leaky raft and told to paddle for your life. The glossy brochures and high-tech ads rarely match the reality for everyday patients. Yes, the top-tier care is truly world-class, if you can afford the astronomical price tag. For those with deep pockets, there are private suites, gourmet meals, and doctors who seem to have all the time in the world for you. But for everyone else, access to this level of care is guarded by your bank account, like a velvet rope at an exclusive club. If you don't have the right insurance or enough money, you're left standing outside, hoping for a chance to get in. For the average person, navigating the healthcare system is like trying to solve a Rubik's Cube while riding a unicycle, blindfolded. There are endless forms, referrals, and phone calls, and just when you think you've figured it out, the rules change again. The wealthy, meanwhile, enjoy concierge doctors who make house calls, personalized treatments, and a level of attention most of us can only dream of. Their experience is tailored, seamless, and stress-free. The rest of us are left to argue with insurance companies over what's medically necessary, often spending hours on hold or fighting denied claims, all while dealing with illness or injury. And in America, your health outcome is often tied directly to your wealth, a terrifying reality in a country that claims to value equality and opportunity for all. The gap between the haves and have-nots is never more obvious than in a hospital waiting room. Imagine facing a life-threatening illness and worrying more about the bill than your recovery. That's the American experience for millions, where financial ruin is just one medical emergency away. Tonight, we'll pull back the curtain to see why healthcare costs so much, who's really profiting from this system, and how the business of medicine shapes the care we receive. We'll also explore what happens to everyone left outside the velvet rope. Those who wait in long lines, who are turned away, or who simply can't afford to get sick. Because at the end of the day, healthcare should be a basic human right, not a luxury reserved for the privileged few. It's time to ask, who gets to step inside, and who's left out in the cold? Why is American healthcare so expensive? It's a question that frustrates millions of people every year, and the answer is far from simple. The truth is, the system is as messy as a soap opera, full of drama, confusion, and plot twists that leave patients feeling lost and powerless. There are no standard prices for anything. Hospitals can charge $60 for a single aspirin, or hundreds for a basic bandage, simply because they can. The same procedure can cost wildly different amounts depending on where you go, or even what kind of insurance you have. The infamous Charge Master is a secretive list that sets prices for every service and supply, but these numbers are often pure fiction. No one actually pays them, but they're used to negotiate with insurance companies and confuse patients. Then come the middlemen, insurance companies, pharmacy benefit managers, and layers upon layers of administration. Each group takes a cut, adding more paperwork, more confusion, and more cost to every step of your care. Every extra layer means more money spent on bureaucracy, not on actual treatment. It's a system where efficiency takes a back seat, and patients are left waiting while costs keep climbing. Unlike most other developed countries, the US doesn't allow Medicare to negotiate drug prices. This gives pharmaceutical companies enormous power to set prices as high as they want, with little pushback. The for-profit motive means hospitals and insurers are often more focused on pleasing shareholders and boosting profits than on helping patients get better. Executive bonuses and investor returns can take priority over affordable care. When revenue matters more than recovery, costs skyrocket year after year. Patients are left to deal with bills that seem to grow bigger every time they visit the doctor. It's a business model that works wonders for investors and executives, but leaves the sick and vulnerable struggling to afford even basic care. That's why a simple doctor's visit can feel like a financial ambush, leaving patients and families anxious. overwhelmed and wondering how something so essential got so complicated and so expensive. For the ultra-rich, American healthcare is a luxury resort, not a maze. Concierge medicine means a doctor on speed dial, 24/7 access, and house calls, for a hefty fee. Hospitals offer luxury suites, gourmet meals, and personal chefs, comforts most can only dream of. The wealthy get cutting-edge treatments, experimental therapies, and the world's top specialists. They're not limited by insurance networks or geography, just by what science can offer. This VIP system siphons off top doctors and resources, leaving the main system underfunded. Innovation chases profit, not public health. The luxury wing doesn't just exist separately, it drains the waiting room everyone else sits in. For most Americans, healthcare is a frustrating, anxiety-filled ordeal. Even with insurance, picking the wrong plan can mean your doctor is suddenly out of network and unaffordable. Wait times for specialists can stretch for weeks or months, delays that can turn treatable issues into crises. Appointments are rushed, doctors are overwhelmed. Then comes the bill, itemized, confusing, and often shockingly high. Even with insurance, high deductibles mean thousands out of pocket before coverage kicks in. Many delay or avoid care out of fear of financial ruin. The system feels adversarial, not supportive. You fight for appointments, coverage, and to understand why you're being charged $2,000 for saline. It's exhausting and it adds stress to being sick. The real impact of this system is seen in people's lives, not spreadsheets. A teacher with cancer is denied the best treatment by her insurer, forced to crowdfund her care. A freelancer's emergency surgery leaves him with a $55,000 bill, more than his annual income. He survives the illness, but the debt nearly ruins him. These aren't rare stories, they're common. Parents choose between medicine and rent. Seniors split pills to make them last. GoFundMe has become a de facto health insurance for millions. The emotional toll is immense, fear, shame, and anxiety over a system that seems designed to fail. This isn't just a policy failure, it's a moral one. When survival depends on your bank account, millions are left behind. Think this is just how healthcare has to be. That endless bills, confusing insurance, and the constant fear of medical debt are just facts of life. Well, it doesn't have to be this way. Let's take a look at how other developed countries handle healthcare, and how different things could be if we made different choices. Look abroad. In Canada, for example, every single resident is covered by public insurance, no matter their job, income, or health status. There's no need to worry about losing coverage if you change jobs or get sick. All you do is show your health card, get the care you need, and walk out. There's no bill to pay, no forms to fill out, and no surprise charges waiting for you in the mail. Sure, there can be wait times for some procedures, but no one in Canada has to worry about going bankrupt because they got sick or needed surgery. Medical bankruptcy just doesn't happen. In Germany, the system is a bit different. They use a mix of public and private non-profit insurance plans, but the government keeps a close eye on costs and quality. Everyone is required to have coverage, and insurers can't turn you away. Hospitals and insurers negotiate prices up front, so there are no wild, made-up charges or surprise bills. The focus is on transparency and fairness, not profit. Taiwan took a different approach, building a single-payer system from scratch. Now, everyone is covered, and they use smart cards to streamline care and reduce paperwork. The result? High satisfaction, efficient service, and universal access. What's really striking is that these countries spend about half as much per person on healthcare as the US does, yet they get better health outcomes, longer life expectancy, lower infant mortality, and higher patient satisfaction. The common thread? In these countries, healthcare is treated as a public good, something everyone deserves, not a commodity to be bought and sold for profit. They regulate prices, invest in prevention, and make sure that for-profit insurers can't stand between patients and the care they need. The Boston's Darren's Trossens will Boston's on keeping people healthy, not maximizing profits. The US system, with its sky-high costs, endless paperwork, and millions uninsured, isn't inevitable. It's the result of policy choices, not necessity. Other nations have shown that universal affordable healthcare isn't just a dream, it's a reality for millions of people around the world. It's possible, and it works. What we have in the US isn't a requirement or a law of nature. It's a terrible decision that leaves people stressed, sick, and sometimes ruined financially. And it's costing us dearly, not just in dollars, but in peace of mind, health, and even lives. Isn't it time we made a better choice? When healthcare is unaffordable, the consequences ripple through families, communities, and the economy. Minor issues become emergencies. The ER becomes primary care for the uninsured. Job lock keeps people in jobs they hate, afraid to lose insurance. Medical debt is a leading cause of bankruptcy, crushing families and ruining credit. The stress leads to mental health problems and broken relationships. When millions are buried in medical debt, the whole economy suffers. A society that lets people die from treatable conditions for lack of money is deeply flawed. It widens inequality and breeds resentment. Health is about more than avoiding disease. It's about well-being and opportunity. By making healthcare a luxury, we all pay the price. The system is broken, but solutions exist, and other countries have proven they work. First, control prices. Let Medicare negotiate drug costs just like the VA does. Simplify the system, cut out for-profit middlemen, and redirect billions from corporate overhead to patient care. Invest in primary and preventive care, catching problems early and saving money and lives. Change won't be easy. Powerful lobbies will fight to protect profits. They'll warn of rationing and socialized medicine. But we already ration care by ability to pay. Real reform means political courage and public demand for action. We need to prioritize health, not profits. The path is clear, if we choose to take it. It's time to put people before shareholders. America spends more on healthcare than any other nation, yet our outcomes are worse. Miraculous technology exists, but only for those who can afford it. For most, the system is a maze of debt and denial. We treat health as a commodity, not a right. Dozens of countries have shown universal affordable care is possible. Fixing our system means regulating prices, simplifying administration, and investing in prevention. We must decide that health isn't for sale. Until care is accessible for everyone, we don't have the best system, just the most expensive.